Hello, my name is Janine Moore, and today I will be presenting on Maddie, a 10-year-old girl diagnosed with Prader-Willi syndrome. Maddie's constant hunger and insatiable appetite, along with her sensory integration dysfunction, cause her a great deal of anxiety and frustration, interfering with optimal occupational performance at home and in school. Therefore, her family is seeking occupational therapy services to address sensory processing concerns and delays in fine and gross motor skills. Two occupational performance concerns are that Maddie demonstrates decreased involvement in physical activity and play and leisure activities, as well as fine motor delays and sequencing deficits that present impairments with self-care skills such as brushing teeth and dressing. Occupational performance strengths include good visual perceptual skills. Maddie loves to put together wooden inset puzzles. She also loves to help Mom with cooking dinner by gathering the needed ingredients. She is socially very active and has a positive demeanor when cooking with Mom. I predict these strengths and weaknesses due to the characteristics of the multi-system involvement of Prader-Willi syndrome, such as endocrine abnormalities, hypotonia, developmental, and intellectual delays. Three underlying factors and characteristics of the diagnosis that need to be addressed during the assessment and intervention plan are as follows. Sensory processing limitations interfere with development of adaptive responses. Decreased activity levels and obesity can cause health concerns. Hypotonia, poor bilateral coordination, and poor gross motor skills are common in Prader-Willi syndrome. These factors should be addressed in order to improve self-regulation and the ability to respond appropriately to sensory stimuli within the home and school environments to improve health and well-being and improve skills required to engage in play and leisure activities. The developmental frame of reference is useful when assessing and treating a child with Prader-Willi syndrome. This frame of reference views development as being sequential and understands that interruptions in development may occur due to trauma, conditions, or injury. Mastery of developmental skills is required to achieve coping strategies and adaptive responses. Therapists challenge the child's abilities by grading tasks to a level slightly above their level of mastery. The developmental frame of reference promotes learning and plasticity of the brain. It is also important to incorporate AIR's sensory integration, as Maddie has limitations in processing, modulation, and integrating sensory input. The AIR sensory integration model works toward appropriate registration of sensory input in order to develop adaptive responses to the demands of the environment. The child's movement and behaviors during occupational engagement are guided by sensory integration. I would select the Sensory Profile 2 as a top-down, strength-based assessment. This assessment is based on Winnie Dunn's sensory processing framework. The SP2 is appropriate for the use with Maddie because it identifies sensory processing deficits across home and school environments and will facilitate development of goals and intervention strategies based on how her sensory deficits affect occupational engagement across settings. I would also select the BOT2 as a bottom-up assessment to identify Maddie's strengths and weaknesses in fine and gross motor areas. A study by DeWall and Paneer established the reliability of the BOT2 in identifying fine and gross motor deficits in overweight school-age children. An underlying characteristic of Prader-Willi syndrome is obesity and decreased activity levels in leisure and play. Therefore, the BOT2 would be a good measure of deficits and strengths in fine motor precision, fine motor integration, manual dexterity, bilateral coordination, balance, running, and upper limb coordination. Occupation-based outcomes based on Maddie's case are that she will engage in 10 minutes of structured gross motor play. She will also sequence the steps of toothbrushing. I predict these outcomes because treatment interventions will focus on a mastery of the performance skills required for each specific task. Two COAST goals that I would establish for Maddie include the following. Number 1, Maddie will actively engage in structured physical activity, such as a game of tag or ball games, for 10 minutes, given less than 5 verbal, visual, or gestural prompts during recess, PE, or outdoor gross motor play at home within 3 months. Number 2, Maddie will sequence the steps of toothbrushing, given less than 3 verbal cues, with the use of a printed visual support within 3 months. Progress towards Progress towards goals will establish by collecting data on the number and type of prompts required to complete the stated tasks in a SOAP note each session. Thank you for watching. Have a great day.